Hi everyone. Hello everyone. Hi. Happy Wednesday. Good to see you all. Hi everyone. So we have a very special guest tonight in our live and talking all about gut health. It's great and I can't wait to introduce Dr. Pedre to you all. I'm sure a lot of you know him already and seen his work, his Instagram, all his videos and website. Type any question you have, you can type it down in the question box or in the comment area. Hi everyone. Type down where are you from. So, yes, Dr. Pedre is an expert in gut health and he is a functional practitioner, an MD. So, I'm going to invite him. Hi, Anahit. Hi, Natasha. Good to see you all. So we received a lot of questions. We will go through those questions and thereafter, if we had more chance and time, we're going to go through the questions here. Hi. Yeah, so you can start typing if you had any questions about gut health issues. And I'm going to now invite Dr. Pedre. Hi, Sarah. Good. You started writing and typing some questions I can see there. That's great. The more interactive, the better. So we're still waiting for Dr. Pedre. Yeah, someone from Western Massachusetts. Good to see you here. We are here from very warm Toronto this year, unusually warm winter. Still not snow, just we had one snow. Oops, Dr. Pedre wasn't able to join us. Let's invite him again. Hi, Lily. Yes, I can't wait to go through Dr. Pedre's book. And one of the most recent one last year was the Gut Smart Protocol. It's a very informative book. Definitely try to get a copy and read about all the problems. Hi, Dr. Pedre. Let me see. Invite. I just invited you. Oh, unable to join. see, invite. And invite. Hi, Janet. Oh,
Hello.
hi.
Hi, how are
Good.
you?
Thanks. How are you, Dr. Pedret?
Doing good. Doing
So
really good.
where are you now? Where are you, in New York or Florida?
I'm in New York. Yeah,
Good.
I'm in my kitchen. One
Good to
of
have
my
you.
favorite places to
I
be.
know, of course. So we received some questions. First of all, thank you for accepting my invitation and joining us tonight. It's great to have you. And before we start going through the questions that we received, if you just introduce yourself to people who not know you, would be great.
Hello, everyone. Good evening. Thank you for joining us. I'm Dr. Vincent Pedre. I'm the author of 2 books on gut health. The most recent one actually just came out last year, the Gut Smart Protocol, which is a 14-day personalized gut healing plan based on a quiz that I created called the Gut Smart Quiz to figure out what your gut type is. And I've been in functional medicine for over 15 years, and uh, before that trained in internal medicine and medical acupuncture, and really practice holistic medicine, mind, body, spirit, with a focus on good health, but really dealing with the whole person. So I look at the body through the lens of the gut and the gut microbiome, but always still take care of the whole person, which is why in both books that I've written, I talk about mindset and things like the importance of gratitude and the gut brain connection and how important that is as part of the healing process.
Great. In fact, one of the questions about that gut-brain connection. So one of the common questions I received is about people questioning about the normal bowel movement. How do you explain? They're a bit confused, like what is constipation? Some people think if they have everyday bowel movement, but even if it's small or hard pellets, hard stools, that is normal. So what is, if you just give us a description of normal bowel movement?
Well, normal bowel movement is at least once a day, so every day. And you want a bowel movement that's easy, that it's not too much effort. So if you're going every day, but you're straining, you're pushing hard, only little pellets are coming out, when you finish, you don't feel complete, then that is not normal, and that's still considered constipation. So it's a feeling of completeness when you have a bowel movement that you've emptied everything that needs to come out and you feel light, your tummy is flat, and you feel good.
Mm-hmm. And again, we see a lot of people, especially when they get older, more prone to constipation. And one of the questions, how to treat constipation, that I'm still working as a family doctor, and one of the common presentations, especially elderly with constipation, if what do you recommend for treatment, or any supplements you recommend people take that help with the bowel movements?
Yeah, I mean, first we need to think about the overall lifestyle of the person, because yeah, we're talking about this, but what you do and how you live your day is affecting this. So starting with movement, movement is very important. So especially as people get older, they become more sedentary. So getting out and walking or doing some sort of exercise, whether it's a jog or a run or a bike, whatever your body can tolerate based on your underlying physiology. And then hydration is very important also, which is also another thing that as we get older, our our thirst response actually diminishes. So elderly tend to be more dehydrated because they just don't remember that they need to drink fluids throughout the day. So dehydration can then lead to constipation. And then we want to look at diet. Diet is really important. I know people want me to probably jump to like, okay, what supplements do I take? But really, first, the basics: movement, hydration, diet. A lot of people are not getting enough fiber, especially non-soluble fiber that helps push things along. So this isn't across the board for everyone, but a lot of people, just by increasing the plant content of their diet, they can actually become less constipated because now they have more fiber, more things to push through. So making sure you're getting the right amount of vegetables, here we say 7 to 9 servings per day, but really increasing the leafy greens if you can. Now, as people get older too, so I will keep pointing back to people get older, they might not be able to digest those vegetables as easily. So maybe they have to be lightly cooked, maybe sautéed, something like that. But you can still be creative, even have like sautéed spinach, or just to get that green and the fiber in the diet, or broccoli or other types of vegetables. And then you want to make sure that in the diet that you're getting enough healthy fats. So you want to make sure olive oil, omega-3 rich foods, because you want to think of fats as the lubricant. So if you want your engine to work properly, you want your pipes to move, they need to be lubricated. The same way that if a door gets squeaky or if an engine starts getting squeaky, the parts aren't moving quite right, they need oil. We also need to make sure. And interestingly, that's a good segue into supplementation, because sometimes I found that just supplementing an omega-3 supplement in someone who was already getting movement and hydration and the right foods, that adding the omega-3 actually helped improve the bowel movements. So they needed that extra lubrication on the inside. And some people have not enough water in the stool, so they need to draw more water in to help. So if your stool's coming out too hard, then that's where you want to think about using things like magnesium citrate or mag oxide, which is a bit stronger. And also looking at other ancient remedies like Ayurvedic Triphala, which is a combination of 3 different Ayurvedic fruit extracts like amalaki and babitaki, and that helps stimulate the bowel and get things moving. Then for a lot of people, sometimes the right thing is a probiotic. And probiotic bacteria also help to stimulate peristalsis. So, and then sometimes it's a matter of testing different probiotics to see which is the probiotic that works best for you. So you can look at it in these different ways. Now, notice that I didn't mention a laxative in there. So I try to keep people away from laxatives and go more towards lifestyle interventions, natural supplements, ways that we can help improve bowel movements. Even self-massage, like starting here in the right lower quadrant and massaging in a clockwise fashion around the belly while you're lying down and relaxed. That can also help encourage the bowel movement. And another thing that we sometimes use is a castor oil over the liver, castor oil packed with heat that opens up the bile flow, and that also helps relax the gut and get things moving. Now, some people, I'm drinking tea right now, but some people like to have coffee in the morning because the coffee has a stimulant effect that helps them go to the bathroom. So this is, for some people, you just have to be careful because a lot of people will put dairy in their coffee. And dairy, for women especially, can be very constipating. So you have to be careful with cow dairy and its constipation effect, which a lot of people wouldn't think, because You think of dairy, a lot of people are lactose intolerant. Usually that causes gas and diarrhea, but surprisingly, dairy can also cause constipation.
Very interesting. I don't know if there is a link. Probably is one. I just started treating one of my patients for weight management. It's a combination of compounding injectables that we give twice a week, and she always suffered constipation. One of the ingredients of this injection is inositol. So I guess that's why she says, first time in my life I have regular bowel movement. It's just great. Whatever is this compound is doing to her. But inositol, I don't know if that's one of the reasons that helping with her bowel movement. So there we go.
Interesting.
Yes.
Yeah.
Very
It
interesting.
helps with muscle and mitochondrial function, and so maybe
Yes.
that's the avenue to it helping.
Yeah.
The other thing is vagus nerve malfunction. So a lot of people are highly stressed, and when you get really stressed, that connection, that avenue between the gut and the brain actually deactivates. So the vagus nerve controls things that comes from the brain and innervates all of the internal organs, including the gut. And the impulses from the vagus nerve control things like the rhythmic contractions of the intestines, the peristalsis. And when we get stressed, the vagus nerve kind of gets paralyzed, and it's not sending those signals down from the brain, and it interrupts our digestion. So some people, when they get stressed, they feel like a rock in their stomach, or they can't eat. You lose your appetite. Those are signs that your vagus nerve is not functioning properly. Or you're stressed and suddenly you can't, there's certain foods, they just sit like a brick in your stomach, like you can't eat red meat, for example. That's another sign your vagus nerve isn't functioning properly. But being constipated is also another symptom of vagal nerve malfunction. I talk about it in my book on ways that we can reactivate that vagus nerve, which I think I'm going to say is epidemic in modern society, because I think we are, if you're not psychologically stressed, you are biophysically stressed from the overstimulation that is happening nowadays. Even just from being on social media and flicking through your phone, and all of this stimulation that's coming at us in different directions, or a demanding job, and or trying to juggle a lot of things, like uh, or moms who also have full-time job, and they're being mom, they're being wife, they're being, so we're all juggling a lot more things than I think we did long ago. And that also causes, I think, is causing an epidemic of vagus nerve dysfunction that also leads to anxiety and depression.
Yes. So how to improve, some of the ways to improve or activate that vagal nerve? What do you suggest?
Yeah,
I know that
even just some deep breath work, deep diaphragmatic breathing is one way that I teach people how to do that in my book. And I'm actually going to be talking a lot about this in my upcoming course, Gut Brain Mastery. That's going to be about how do we slay our stress, sharpen our focus, and improve our intuitive capacity by really working on that vagus nerve. Anybody who's listening now can learn more about it by going to drpedre.com, drpedre.com. And so one way is deep breathing, deep diaphragmatic breathing. But another way to activate the vagus nerve is to hum or to sing. So one way, so thus why there's in ancient traditions, like in yoga, like you do the breath, the in breath, and you do the om. When you're doing that vibration here, because the vagus nerve travels down the neck on both sides, it helps stimulate that vibration, helps stimulate the vagus nerve, and thus chanting, like when you're in the presence of chanting. I don't know if you've ever heard Buddhist monks
yes,
chanting. I
yes, yes.
I went to a Buddhist Tibetan Buddhist meditation, chanting meditation, and I never realized, like, I've listened to it, but being present with it, it is so powerful. Like, it gets you into an altered state. But even humming, singing, anything that helps hear the vibration. And then surprisingly, having fermented foods can help improve vagal nerve tone because our little bacteria helpers, probiotic bacteria, produce postbiotic signals that stimulate the nerve endings of the vagus nerve. So a lot of times we don't think about that we can actually also improve vagal nerve tone by the foods that we're eating.
Very interesting. This is new, the probiotics. Now, talking about probiotics, one of the questions, a very general question people ask is, which one is more important, taking probiotics or prebiotics for gut health? And so which one to take, and should we take it every day, naturals or supplements?
Yeah. So here is the issue, and I know if you're like just going through social media or the internet, like
Oh,
you're gonna see a lot of conflicting information out there.
absolutely. Yeah.
When I want people to think of it this way, when you're taking a prebiotic, it's like taking a generic feed for your gut bacteria. You don't know what you're going to be feeding. When you take a prebiotic, you're basically feeding anyone and everyone and anyone in there who likes that particular prebiotic, whether it's inulin, whether it's fructooligosaccharides, whether it's galactoligosaccharides. There's certain bacteria that like different types, but it could be good and bad bugs. And those bugs might be in the right or the wrong place, or maybe you take too many prebiotics and then next thing you know, you're all bloated and gassy and not feeling so great. So prebiotics can be great, but too much of them can actually make you feel kind of blah, not so great. So you have to be careful, because I know in the Western world, we translate like, oh, if I heard this is good, so let me take more of this. And the thing is that there are prebiotics in the food that we eat. So when you're thinking like, well, why are you taking a prebiotic supplement when you can get it in the foods that you eat? You know, all different types of foods, from fruit to vegetables like scallions, garlic, onions, Jerusalem artichoke, dandelion greens, bananas, blueberries. They all have prebiotics.
Mm-hmm.
So in general, we should be eating a diet that has a variety that gives our gut those prebiotic nutrients that are necessary. Now, probiotic is a bit different, and it depends on the probiotic that you're taking, because if you're taking a quality formula that is not just the species and genus name, so it's like Lactobacillus acidophilus, but it has a strain name, a little code that follows the name of the bacteria. These are clinically researched strains that have been found to have certain effects in the body. So they can reduce inflammation, for example, or they reduce the likelihood of allergies, or they help with IBS or inflammatory bowel disease. So these can be really targeted in the way that they can help the body. Whereas when you're taking a prebiotic, you don't know how it's going to target. It's not targeted. It's very general, and it could actually make you feel worse. Now, for some people, it could be helpful to take a prebiotic, or another name for them are resistant starches. And there's good evidence that resistant starches, like, for example, I have them here because I was doing a video on them.
Green
Green
bananas.
banana. Yeah, so green banana, very rich in prebiotic resistant starch. And these bananas actually don't mature, so they never turn yellow like these here. They have stayed green. And green bananas are a really great source of resistant starch, and the type of starch that our microbiome loves to eat.
Mm-hmm.
But again, if you have dysbiosis, if you have bad bugs in the wrong place, So too many of them growing in your small intestine. And now you start feeding yourself prebiotics because you heard this is good, but your gut is a mess. You're going to feel horrible because you're feeding the bad guys too that are in the wrong place, maybe too many of them in your small intestine. So again, everything is based on the terrain, the setting in your body. So if you know that things are not quite right, then you have to be careful about the choices that you make. And it might actually be better to start with a probiotic and very specific probiotic. Maybe it's a Bacillus coagulans that has very specific properties that helps improve bloating and improve bowel movements and reduce inflammation. So again, it's a bit more nuanced, and I think people have to be careful what they're marketed to, because there's a lot of people out there telling you, "Oh, have more prebiotics because this is good for you," and I think that it requires a bit more understanding to know if this is the right thing for you.
Exactly, and you explained that very, very good. So hopefully people now realize so they shouldn't just go and start buying from Costco or any store free buy
Exactly.
and
Yeah,
probiotics.
and also quality. Like, pay attention to where you're buying things from, because if you're buying it from a mass supplier like Costco, do you think they're using the best quality ingredients in their brands? I mean,
No.
you have to be careful because that might be coming from China, and that could be
Yeah,
contaminated with heavy metals. I didn't even
exactly.
know you were going to ask me about prebiotics, and here I was with my green bananas that I just happened to be in the kitchen hanging out with my. By the way, these are incredible. So my background is Cuban, so part of what we cook with green plantains, and I had never cooked with a green banana, and I thought, well, let me test this out. It's not the easiest thing to peel, as you know, because the skin, the outside skin is still kind of very, so you have to kind of like cut it down and peel it in quarters. But this on fried with some olive oil is
Yeah.
incredible. Is really incredible. And of course you can put it in a smoothie. So sometimes I'll put it in a smoothie. Again, you have to make sure your gut is healthy, because this could also make you very gassy and bloated if things are not quite right inside.
You're right. Alcohol. So people asking, so we drink, and as soon as we drink
I'm having tea here.
wine or something heavier than wine, and we have a horrible night with bloating and gas and what to do, or I mean, obviously the advice is stop drinking, but if we want to drink, first of all, why alcohol does this to us, and how, if there are any supplements we
Look, this
can
is
take before or
this
after.
is the thing. You can't have your glass of wine and heal your gut too. It's kind
Exactly. Yeah.
of like you can't have your cake and eat it too. But I'm sure you've had those patients where they're like, well, can I, you tell them you can, if you want to heal your gut, you cannot drink, because there are several reasons. Alcohol increases inflammation. Alcohol is a gut disruptor. It actually causes dysbiosis. It increases gut permeability, so it's increasing leaky gut. So you're basically going in and just messing everything up. Now, I'm curious, people were listening here, like, if you the day after you go out, let's say you go out and you go out with your partner, your loved one, or you go out with work colleagues, and you have 2 to 3 drinks that night, do you pay attention to how your gut behaves the next day? Is your gut feeling kind of off? Do you need to run to the bathroom? Do you have some loose stools the next day? All of that, those are signs. That's your body telling you, hey,
Mhm.
this is not working for me. But
Yeah.
if you want to heal your gut, and fourth, I should say that alcohol also oftentimes has sugar with it. Unless you're drinking like straight vodka or tequila on the rocks, or with soda water, there's a lot of sugar in alcohol or mixed drinks or wine that can feed bad bacteria or yeast in the gut.
Mm-hmm.
So it is a gut disruptor. There is no question about it. And if you want to heal your gut and reduce inflammation in your body, or you want to lose weight, you can't have your glass and heal your gut too. You just can't.
No.
And I know that's a tough one for people. So, oftentimes I tell people, look, do it for 4 weeks. Anybody can survive 4 weeks. And then after that, you can reintroduce, but pay attention, because I don't want you to reintroduce and be ignorant of what's happening to your body, because a lot of people are ignoring their body cues. So when you introduce, I want you to pay attention to what changes, if anything changes in your internal environment. And during the time that you're not drinking, I want you to think about, what does that alcohol mean to you? What does having a drink mean to you? And what does not having that drink? Were you having a drink to deal with stress? Are you having a drink to escape from your work, from your personal life? Like, what is that, having that one drink or two or three, what does that mean to you? And can you sit with those things outside of having alcohol? Can you sit with the emotions, maybe the emotions that you're trying to run away from? Some people are emotional eaters, but some people are drinking, and no judgment here, because I'm in there too. I'll raise my hand. I've had that one drink at the end of the day as the way to escape from the stress of the day. And I
Yeah.
actually, mostly last year, thanks to Huberman and other reasons, decided to mostly curtail drinking. So probably like 99%. I'm also a big believer in not being like rigid, like dogmatic, like not restricting yourself, because what happens is, for a lot of people, when they say I can never do this, is you get that restrictive mentality, and then it just takes that one time and you just go overboard and you go on a binge. It's like saying you can never have dessert, and then when you have that one dessert, you're like, you just throw the kitchen sink out and you're just eating the whole cake, right? Is that anybody with me on that? Yeah. Yeah, you know how it is. So I'm a big believer in not creating rigid uh, rigid guidelines.
Mm-hmm.
And I find when I've done that, I actually stick to things better.
Yeah.
So I'm telling myself that I always have a way out. I always have a choice. And actually, probably the biggest, most social drinking time and with my family is the
Mm-hmm.
holidays. And this year, this is how much alcohol I had during the holidays.
Wow. Bravo.
Zero. Zero. And it's something that is very social. So some people, they don't drink most year, but they'll drink in the holidays. And I decided, again, I think because of gut health, but also I always want to be an example for people, and I want to walk the talk that I tell people to do. But I also want to understand, because why are you having alcohol? Are you having it to help you navigate stress? Are you having it to help you navigate social anxiety? Are you having it to help you have a good time when you're out with friends? Are you having it to deal with family that you have to see during the holidays? And if that's the case, can you be present with yourself and with those around you, and allow those uncomfortable emotions to bubble up? I always say that we digest our emotions in our gut, because a lot of times when we feel stressed, we feel anxious, you're feeling it here, right?
Yes.
So I
Butterflies.
think of our gut, I know this is more metaphysical, but I think of our gut as the place where we digest and process our feelings and emotions. But if we're disconnected from our gut because you're drinking to numb yourself, then you're not processing your emotions. It's
Mm-hmm.
just a band-aid remedy. And so I'm sorry I digress, but the point is, if you want to heal your gut, you can't
No.
drink until the gut is healed.
Exactly.
You cannot drink. And if you want to cheat, once your gut is many steps down the healing process, then it's going to be either tequila or vodka on the rocks, which is very low sugar. It's not going to bump your blood sugar.
Mhm.
And not that I'm saying go drink. You know what's great is that now there's these new brands coming out with these non-alcoholic spirits that it almost feels like you're having a drink, but it has zero alcohol. It's usually made with essences of flowers, essential oils,
Yeah.
things like that. They're almost more like an aperitif, but without the alcohol. And those can be a really nice substitute for having a
Mm-hmm.
drink.
Mm-hmm.
I was invited to a party recently, a farewell party at a bar. So I knew when I got there that everybody's going to be drinking. And and I don't want to have to explain like, oh no, I'm not drinking like that. So what I do is I went to the bartender and I just said soda water with a lemon. That's it. Once you have the drink in hand, nobody knows that you're not drinking.
Exactly.
So you
Yeah.
don't have to you don't have to explain yourself, and you can look like you're having just as good time as everybody else.
There we go. Talking about elimination. So, elimination diet, we keep hearing about it. So, that's again one of the questions, maybe helping with some of the gut health problems like SIBO
Yeah.
or small intestine overgrowth. So, what's your approach to elimination diet normally? What's your recommendation to your patients?
You know, it varies. So in my book, it's more of an all or none, mostly. But
Mhm.
I also explain here the importance of being intuitive and listening to your body and doing things in a way that's going to be successful for you. Because if you're, if say this is the this is where your diet is now and you need to be over here and you've got to eliminate a bunch of things that are going to require you to completely reprogram the way that you eat, and that's going to be really difficult because if someone's telling you take out gluten, dairy, soy, corn, and you're just like a deer caught in the headlights saying, what am I going to eat?
Mhm.
So I'm also a believer in what I call stepwise
Mhm.
activations. Instead of eliminating everything at once, and this is what I do with people when I work one-on-one with them, I tell them, okay, what is the easiest thing for you to do first? Can you give up bread at the table or when you go eat out? Okay, so we're gonna focus on that. You're gonna take out bread in the first week.
Mhm.
Okay, now second week, what are other sources of gluten in your diet that we can start to take out and substitute with healthier alternatives? So we focus on one food group to eliminate. Get really good at that, and then now we add the next step. So this is the stepwise activation because now you're setting up for success, not for failure.
Mhm.
But if you're not used to doing these things and you try to knock out five things all at once and you get overwhelmed and you don't know what to cook and you're confused, it's a lot to handle.
I agree.
So I like for people to conquer one thing, get good at it, and then and start the next one. Yeah, it's going to be a little bit slower. It's going to take a little bit longer, but you're going to be more successful and you're more likely to not abandon it before the end.
And when is the end? So, what normally you recommend to reintroduce one at a time? After how long?
Yeah, I mean,
Again, is that?
once you've taken out all the thumbtacks that you're sitting on, because if you take out two foods, but the third one is causing problems, it's like saying you're sitting on three thumbtacks. If I take two out, you're still going to feel the pinch from that third one, right? So you
Mhm.
have to take all of them out eventually in order to allow for that gut healing to happen along with a gut healing protocol. And then ideally, I know some of the elimination diets go as short as 2 weeks, 3 weeks. I really think that in order to reset the immune system, you need those 4 weeks minimum. Sometimes I'll have people go as long as 6 weeks. And at that point, you can start doing a reintroduction, one food at a time, once every 3 days, watching for a reaction that could either happen on the day you introduce the food or even the next day, or even a change that takes up to 48 hours later to kick in. And at that point, your body is more of a blank slate. So it's easier for your body to then speak back to you and tell you that this food is a problem, right?
Yes.
But what I find is a lot of people, when they get to week 4, they are feeling so much better than what they felt back then 4 weeks ago when they were eating all the sugar and the wheat and all this, that they tell me, you know what, I don't know if I want to go back to all those things.
Yeah, especially alcohol. I see a lot of those who stop, they're really happy, even with their sleep. Some people even drink it to sleep, but they not know that
Yeah,
how
even
bad
even
effect.
even people who drink alcohol to sleep don't realize that it's actually messing with your sleep architecture, your REM sleep, your deep sleep. So even though it makes you fall asleep, it's actually giving you less restful sleep in the end. And look, if you want to stay looking young as you get older, less wrinkles, then
Everything. It's a
no.
poison.
Yeah.
Someone is asking here, is constipation danger sign or for cancer?
It could be, but that would be more like colon cancer. So especially if you have a cancer that is blocking the intestine in any way, that could lead to constipation. So again, it could be. It's rare that it is, but it is within the differential.
Yes.
And even diarrhea could be a symptom of cancer as well.
Yes. What do you think about coffee enemas? Any thoughts on that?
They can be really helpful. Again, depending on the person and depending on whether they are caffeine sensitive or not. But a coffee enema, because the caffeine goes through the portal circulation to the liver, then opens up the bile ducts and helps move bile, helps in detoxification. It can help people, sometimes people who are migraine sufferers can do a coffee enema while they're having a migraine, and it can help clear up the head. Also, people who suffer from brain fog and also do coffee enemas. I would say you just have to be careful not to do too many of them, and also not to use them as a band-aid remedy for what's really going on, which is imbalances within the gut itself.
Any thoughts about betaine HCl for chronic constipation?
Well, you have to think of betaine HCl more as aiding in protein breakdown, so digestion. And I think it's really important in terms of being able to break down that protein in the stomach with the proteases that are produced in the stomach, the pepsin, helps with knowing when you are full. If you have low stomach acid and you're not breaking down the protein, then you're not going to get those amino acids to help signal that you are full to the brain. So it helps with those things as well as with neurotransmitter production, which is going to help with peristalsis as well. So it can play an indirect role. It's not a direct thing that's going to help constipation, but indirectly, it's very important. It's a cascade. The whole digestive process needs to happen correctly from the top to the bottom. And the thing is, one of the most prescribed medications worldwide are medications that lower stomach acid. So they're basically interrupting the first important domino in a series of a cascade of events that need to happen as the food goes down the digestive tract. So it's disrupting our natural digestive rhythm.
Yes. And it's, you can't imagine how many patients I see that they they're taking antacids every day and they're still complaining. We still have GERD symptoms, acid reflux symptoms, and of course that's due to suppression of the
And
acid probably.
again, this ties back to what I was saying about the vagus nerve, because another symptom of low vagal tone is acid reflux and low stomach acid. So these
Mm-hmm.
patients who are taking excess antacids, you have to wonder, are they stressed? Are they is their vagal tone affected? You know, are they slowing down? Are they breathing? Are they meditating? Are they doing their self-care to help wind down their nervous system so they can be more in a parasympathetic state that allows them to digest more easily?
Now I'm just going, someone's saying I will start humming more. I've never had it explained this way. Fascinating. Thank you.
Awesome. Yeah, more to come in my gut brain
Yes,
mastery
tell us,
program.
yeah, tell us a little bit about that program. I'm so
So I
glad to hear.
basically this is my first digital course that I've ever done, and it took me a while, I think, because I could have made a digital course on this, on the book, and then like the Gut Smart program, but I wanted to do something slightly different, and I wanted to do something that helped the widest number of people. And I think there is an aspect of mental health that is completely missing the underlying picture, which is the gut brain connection.
Mm-hmm.
And as I wrote this book, I realized, like, and the way that I work with patients, the most important thing before you can start working on the gut is you've got to work on the mind and the mindset. You almost have to rewire the way the person approaches life and thinking about the vagus nerve and all that. So I decided to put this program together, the Gut Brain Mastery Program, as a transformational program to help people who are suffering from stress, who suffer from anxiety, who suffer from mental or mood issues, who have poor focus. And I tie in the intuitive aspect there because I think of the gut as our first intuitive brain, but really in order to have our intuition working for us, and that could be life choices, choosing the right foods to eat, choosing the right things to do for yourself, you've got to have that gut brain connection
Mm-hmm.
working properly. So it's a 6-week
Mm-hmm.
course with 6 different modules. It's self-paced, but I will be launching this at the end of February. I'm going to be actually doing some free master classes, but anybody who wants to join the wait list can go to drpedre.com, drpedre.com. They can also go to happygutlife.com/gut brain mastery. Happy Gut. So that's Happy Gut Life, life.com/gut brain mastery. And so there I've got, they can join the waiting list, and very soon I'll be opening it up for enrollment towards the end of the month. And I'm going to be covering a lot of things like the vagus nerve, but I'm also going to have practicals where I'm teaching meditation, I'm teaching breath work, I'm teaching these techniques. We're going to be we're going to be biohacking brain health by looking at the diet and specifically certain strategies in the diet that can help improve the way the brain is functioning by focusing on the gut. And we're going to be talking about ways to also increase intuition and listening to the body and
Mm-hmm.
intuitive eating. So I'm really excited to put this together because it's my first course ever. But it comes from my wealth of experience putting books together. And I think it's going to be a really excellent course. And I think I see so many people in this world suffering from the effects of stress and anxiety. And if they could only know that what they think is in their brain and their mind is also coming from their gut, And if we can almost take a backdoor to the brain by working on the gut, and that will improve things in the brain. But I think of it as a bidirectional circuit. So in my course, I not only work on gut health, but I also work on the brain aspect as well. And by doing that dual approach is what magnifies the results. And my goal is to really to teach people how to be able to live with their stress, to activate the vagus nerve, to improve their mental health through their gut. And really by doing this, then you can basically live the most optimal life that you want, right? Because when you're happy, when you're stress free, when your intuition is working, then you can make the best choices for yourself.
Yes.
And you can be the healthiest that you can be that way.
Absolutely.
So I don't think enough people right now are talking about gut brain, and it's not going to be just a teaching course. It's actually going to have very practical applications that you're going to start noticing even from the first week, ways that we're going to improve that gut brain connection to help people feel less stress, more focus, and greater intuition.
Yes. I can't wait. I have to join you then.
Please, please do. I mean, everybody deals with stress in some way or fashion, right?
Especially pandemic, lockdown, all those 3 years.
And
It's just
I think right now, I don't know if you feel this way, but I feel that the world is still processing what happened, and that we're not fully recovered from that. And at the same token, we're in a complicated world. Like I see it with my son who's 19, who has had a lot of anxiety. And if you look at college kids now, they have twice the rates of anxiety that they had 10 years ago. And I'm not saying it's not just because of the current world, it's social media, it's it's the very fast pace of our life now, that we're losing connection with certain things, and especially that gut brain connection and that intuition and that grounding that is so important for feeling, for being able to be resilient and handle our stress, right?
absolutely. I mean, it may never go back to our past normal. So it's better we adjust and use these skills that you're talking about
Yeah,
to.
become a master of your gut brain connection rather than letting your brain control you.
Yes, yes, very good. So just wrap it up in a few minutes. Go through one question, which is a very general, big question, very open. How do one find out if everything is all right in the stomach, intestine, what to do?
I mean, one, you have to ask yourself the question, do I have any gut symptoms? And that can be primary question. But if you don't have gut symptoms, that doesn't mean you don't have a gut related health issue, because the gut is connected to every system in the body: the brain, the skin, the lungs, the airway, the immune system, your metabolism, your energy levels, your joints, even your bones. The gut is related to the development of osteoporosis. So that's why I created this quiz in my book, the Gut Smart Protocol. The quiz is designed to see what level of gut dysfunction you have. And the quiz asks more questions than just gut questions. So you may say, like, well, I don't have any gut symptoms, but do you suffer from migraines? Do you have headaches? Do you have allergies? Do you have an autoimmune disease? So I ask all these questions and then give you a score that tells you if you're mild, moderate, or severe. And that then tells you what plan to follow. So
Great.
that's what I basically put this together after realizing that no one diet was right for every gut patient that came in through the door. And I realized that each one is unique, and I had to create a program that addressed that uniqueness by personalizing it to the individual. because if you have mild gut issues, it's not the same if you come in through the door and you have severe gut issues. You can't have salad because you can't break it down, and if you try having fermented foods, you don't feel well, you get bloated. So that's what I answered with this book after years of working with gut patients and realizing that no two guts are the same. So how can their diets be the same?
Very good. Great. And we can't stop listening to you, but I have to let you go,
I have
Dr.
to
Pedre.
make dinner now.
Me too. It was lovely seeing you.
Maybe I'll fry up some of the green banana.
Prebiotic.
Now that we're talking about it, every few days I've been having some of these.
So everyone know now where to find Dr. Pedre, drpedre.com.
Yeah,
Am I right?
and when they go there, they can sign up to be on the wait list for my upcoming Gut Brain Mastery course, which is going to be launching at the end of the month. So I'm super, super excited about that. My son has suffered from mental health issues, from anxiety. And even when I was younger, I had periods when I suffered from a lot of anxiety and sometimes from depression or mood swings. And so creating a program like this is something that's very near and dear to my heart. And when I think of all the people out there who can be impacted by this program, like it just fires me up.
Beautiful. Great. Well done. Keep up.
Thank you so much. Thanks
Thank
for
you.
having me.
It
It's
was
so good
great
to see
to
you.
you.
Good to
So,
meet you in person.
yes, hopefully soon.
Sounds good.
Thank you. Thanks, everyone, for joining us. Have a lovely night. Take
Have a
care.
good night.
Bye-bye.
Bye.